Vitro fertilization has long been one of the most successful and most widely used methods to help couples who are having trouble conceiving a child. But there may soon be a cheaper and more personal way for couples to have a baby in the U.S., and it's being developed right here in New England. INVO Bioscience is located in Beverly, Massachusetts. Its product is called the INVO cell, and it's already being used in countries around the world. CEO Kathleen Karloff is our guest on Business Day. Kathleen, good to see you.
Thank you. Nice to have.
So you brought by one of these devices, the INVO cell. Explain how this works and how it's different from what we know around New England as in vitro fertilization.
Sure. In vitro fertilization is done in an IVF lab, as we all know, and there's many around the country, especially in the United States. With our device, the primary difference is that we use a low stimulation protocol so that we produce less oocytes, less eggs, than normally from the female. The eggs are extracted and put into our device. Basically, this is the inside part of the device. The eggs are retrieved, placed right into the device. The prepared sperm are placed in and topped with a culture media that allows fertilization to take place in embryo development. The device is then closed up and is placed into this container, which allows it to stay sterile and clean. And then the actual incubation takes place in the woman. So once the gametes placed in here, is placed up into the vaginal cavity behind the cervix like this, where it sits for 3 days. And the vaginal cavity actually supplies the correct pH, temperature, and carbon dioxide to allow fertilization to take place. After 3 days, the device is taken out. This protective part is basically thrown away and is placed in this preheated block for about 10 minutes. During that 10 minutes, the embryos float down into the very bottom of this, where there's a very small microchamber. And once they've come down into the microchamber, the physician just opens the valve, turns this block over to its side, where a microscope comes down, and you can perfectly view the embryos and grade them for quality right from the device. Then they take an embryo transfer catheter and extract the best 2 embryos and transfer directly into the woman. So it's a very simple process.
So it involves the woman. It's not all being done in a lab, but how does this reduce the cost?
It reduces the cost in many ways, mostly because it can be done without the overhead of an IVF lab. You don't need a full-time embryologist around the clock. You don't need to have your incubators with carbon dioxide control and temperature control and backup in case electricity goes down. You lose all your embryos. So it's not only good in many of the developed countries to expand in vitro fertilization, but it's a great alternative in a lot of the developing countries and other places in the world where they don't have IVF centers, so infertility isn't treated. So it allows to treat in many different areas of the world.
I was reading on your company's website, it was started by a doctor. The idea is to make fertility treatment available to women all over the world that might not have the finances to pay for it themselves. You're in countries, Pakistan, Italy, Cameroon, Colombia, opening up centers in South America. Is your product available in fertility clinics and then also some clinics set up by your company?
Yes. We are in many fertility centers. What seems to have been the model is a lot of physicians say, hey, I can expand my business by bringing this into my IVF center, in opening centers with fellow IVF folks as well as OBGYNs to expand their reach under their umbrella so they can reach more infertile patients and bring in more money for the centers. And in some areas of the world where there are no IVF centers, the OBGYNs are adopting it, and we're working with our distributors to train them so they can treat their patients.
Where is the company in getting this device available in the United States?
We need to do a study for the FDA. It's most likely going to be 75 patients. We're in the process of obtaining funding for that. And once we obtain funding, it's going to be about a year before we have approval in the United States.
INVO Bioscience recently went public. In fact, this past December, right when the market bottomed out, Mass High Tech actually did a story about this. You used an unusual strategy to take the company public, a reverse shell merger. It paired your firm up with a salsa company. How did that work?
The salsa company was actually a shell company where the public entity was actually created for the purpose of merging with another company so that they could become public. So what we did is we merged with a company and we became the public entity through the Emmy Salsa, and then changed the name over so that we became INVO Bioscience. And it's a more streamlined way of being able to come into the public market.
All right, CEO Kathleen Karloff, thank you so much for joining us.
Thank you for having me.
INVO Bioscience is out of Beverly, Massachusetts.